What has informed our success? Shaping our future. Let's set the stage for a discussion about adaptive paths forward for Hamilton Health Sciences Foundation by taking a few moments to see our journey since 2010. Vision. As the decade began, we established a 2030 vision of the Hamilton area as a vibrant region, routinely listed among the most livable and affordable places in Ontario. People here have hopes for good jobs, careers, neighborhoods, and a good, healthy future. They have assembled a diverse, multicultural society that is a mecca for Canadians and immigrants as well. World-class institutions support a culture of health and well-being. Strengthening community is ingrained in the local tradition and nourished by a unique community-based philanthropy. The Foundation is a founding pillar of engaged philanthropy to enable a strong region. A decade of strategic growth. Looking at our sector in 2011, we saw inequities in the health status of many, while government funding was not keeping pace with levels of care acuity. Of greatest concern was the disparity in quality of life and health for all Hamiltonians. The Foundation was surrounded by a growing number of charities and changes in the Lynch structure, while donors were losing interest in traditional philanthropy and repeated requests. Internally, we were largely focused on working with volunteers on the site-based fundraising councils. We focused our program offerings and structure to address the priority needs of the Hamilton Health Sciences system while still seeking opportunities to address the social determinants of health. Building upon a strong base of annual gifts and site-based campaigns, we sought transformational gifts to enable wholesale changes in care and the care environment, while enabling a relevant, sustainable, and resilient organization. Our leadership team was building our authentic leadership muscle, and our programs showed signs of growth. By year-end 2019, we raised $208 million in cumulative fundraising revenue, with $150 million reinvested in Hamilton Health Sciences. This made us the region's third largest charity, with growing contributions and impact. New challenges emerge. Philanthropists get personal. In the last few years, our situation continues to evolve as the region's economy continues to diversify and government funding is challenged to keep up with the rising costs of healthcare, potentially impacting hospitals. The rising needs of the elderly and mental health illness across all ages presented new care challenges. Technological advances in health service delivery added a further need for increased philanthropy. Most large donors were focused on designating gifts and sought higher levels of stewardship to realize gift impact. We knew our core donor base was aging and we needed to engage diverse communities and the next generation of philanthropists. The Foundation successfully adapted and expanded a wide range of giving opportunities for all donors to engage based on their motivation to support, targeted our marketing programs, and invested in increasing awareness and the Foundation's branding. With our hospital partners, we inaugurated significant new traditions and celebrated transformational gifts of more than $135 million to support the Stem Cell Transplantation Unit, Nurse Practitioner Fellowship, Children's Health, the largest single gift that McMaster Children's Hospital received, a significant investment in the stroke and cancer programs, Illuminite, and initiated an employee lottery that raised almost $3 million. Steering through a crisis. In 2020, our plans were upended by the coronavirus pandemic. We realized we had to adapt to an evolving environment. Donors focused on emergency needs that felt truly meaningful and tangible. Already, we sense that philanthropic programs have forever changed. Social distancing and the lower numbers for public gatherings have changed third-party and special event programs significantly. Trying to generate meaningful virtual connections will be the new norm. We have seen and benefited from extraordinary community engagement in response to our COVID-19 campaign. Philanthropists are redirecting their support to current crisis-related needs rather than investing in traditional campaigns like infrastructure, equipment, and research. The uncertainty of a second wave of the virus and further economic disruption will impact donors' ability and willingness to invest. On one level, our ability to attract and retain donors will require greater levels of investment in technology and business analytics. On another, we'll need to reimagine meaningful donor-partner engagement around compelling, co-created visions of lasting impact. As part of our continuous adaptation, we are rehearsing multiple scenarios with implications for our businesses and building a new set of strategies that will address the urgent while strengthening the scaffolding for a healthy, secure future. Let's build the playbook for our next chapter at Hamilton Health Sciences Foundation so we lead recovery and build resilience.